Hello, and in this video I'm going to be talking about gadolinium in MRI, what it's used for, how it's administered, as well as the risks associated with it, either being allergic reaction or how it's administered. I'm going to be talking about the scan planes in MRI, as well as different MRI protocols, and lastly, why it's so important to be taking notes at your clinical. So gadolinium in MRI is the main contrast that is used to detect pathologies in the patient. Pathologies usually manifest as an increase in inflammation or fluid. So when contrast is given to a patient, those areas of interest are highlighted essentially. Some of the risks associated with gadolinium can include nausea, vomiting, dizziness, and that's for a healthy patient. So if your patient were to have kidney or renal issues, you would not want to administer gadolinium to them. So you would want to check the patient's GFR or glomerular filtration rate. If it is less than 30, you do not want to administer gadolinium to the patient. If it's over 60, it's completely fine to give the patient gadolinium. Again, you want to make sure that they don't have any prior renal issues or, prior reactions to gadolinium. If they have had it, you want to make sure their kidneys are functioning properly. If they have hypertension, let's say, you also want to be checking. So normally the GFR rate should be checked at least within a month before their MRI exam. So some sites will have it to where you're able to check on site. Otherwise, you want to make sure that the GFR rate was tested at least a month ago or a month prior to them receiving the scan. Now, gadolinium is mainly administered through an IV. It's also given through a power injector, but this is for mostly precise timed scans, such as an MRI. So some problems that can be associated with giving gadolinium through an IV are infiltration, air embolism, or just infection. So I'm going to be going over some important steps that you need to take to prevent any of these from happening. Other potential risks of using an IV are infection. So you want to make sure your hands are clean, you're using sterile materials, the patient's skin is disinfected with an alcohol wipe for at least 15 seconds, 10 to 15 seconds, but 15 seconds is preferred. Another issue would be an air embolus. So this would be where air is actually in the IV and it could be administered to the patient's heart, causing death. So you want to bleed the tubing prior to connecting to the patient. Bleeding it means there's completely no air inside the tube whatsoever. Now, I know it talked about mainly kidney issues or kidney function being the main factor in determining whether or not your patient should receive gadolinium, but another factor would be an allergic reaction. So first you want to see if your patient has had gadolinium before, and if they have they had an allergic reaction to it. Also, if they have not, you want to ask if they have seasonal allergies or asthma, as this can trigger an allergic reaction in the patient. Sometimes you can administer antihistamines such as Benadryl before performing the scan if they have allergies, let's say. But if not, you want to make sure you're keeping an eye on your patient. Communicate, making sure that everything's okay, they're able to breathe, they can swallow, they can talk just fine. If an allergic reaction were to occur, you want to remove them immediately out of zone 4 and into zone 3 and give them the help that they need. If they were to have a severe allergic reaction, again, you want to get them out of zone 4 first into zone 3 or zone 2. You could also give an EpiPen if a very severe reaction were to manifest. So in MRI, we have 3 scan planes. It's the coronal, the sagittal, and the axial scan plane. The coronal plane splits the body from anterior to posterior. Sagittal splits the body from from left to right. And axial splits the body from superior to inferior. So coronal would just be basically a front view, looking at the patient from front on. Sagittal is a lateral view, so the patient is split in half, and axial is pretty much an inside view. So let's say you were to cut a sandwich and look on the inside, that would be the axial view demonstrated. Now, with the 3 scan planes, there's MRI protocols. So protocols are essentially like a shopping list of sequences that you need to run before the patient can leave. Now, some protocols require 2 different scan planes. So let's say you're scanning a shoulder. Some may use an axial oblique scan or a coronal oblique. So you're technically splitting into two different scan planes to acquire a specific image based on the anatomy that you're trying to cover. So the main one that I know personally is the shoulder, because it's such at a curved angle, I would say. So you need to be using axial oblique so you can really get a good image for that pathology of the scan. Lastly, I'm going to be covering why you need to be taking extensive notes during your clinical rotation. So one of the reasons why you need to be taking notes is because you're going to be introduced to a dozen different protocols. And of course, you are not going to remember them because it's going to be so much to remember all at once. Like I said, there's a dozen different protocols. There could be pituitary, TMJ, internal auditory canal, shoulder. So it's going to be a lot to take in all at once. So you want to be sure that you're writing down the sequences associated with these protocols. Also, depending on the diagnosis, some radiologists will want to use specific sequences, and each tech will have their own way on how they like to plan their sequences. Of course, you don't have to follow, the way to a T, but you want to be taking notes because in the end, it will be very beneficial to you as an MRI tech to refer back to.